Hi, I'm Dr. Cohen. As you know from this website, I'm a board-certified plastic surgeon. If you've clicked on this icon, you're going to be interested in liposuction or body contouring. Liposuction is one of the most common procedures done for cosmetic reasons in the United States. I think it ranks number 2 on the list, actually, of all cosmetic procedures done in the last year in the United States, with literally hundreds of thousands of people, if not more, being done every year in the U.S. Liposuction has been done for decades in the United States and has actually gotten better and better over the years with regard to the technology. What is liposuction? Liposuction is the removal of fat cells from your body. You're not removing skin, you're not tightening any muscles, you're just going into an area of a problem of fat and removing the fat cells themselves. There are a lot of misconceptions about liposuction. The first and foremost is that liposuction is a way to lose weight. In fact, liposuction should not be applied as a weight loss measure. The ideal candidate for liposuction generally doesn't even look like they need it. Most people who get liposuction should be at or pretty close to their ideal body weight, but who have exercise or diet-resistant areas of fat deposits. In women, the most common area are going to be their outer thighs, perhaps their tummies. In men, it's their chests and their area of breasts or their love handles. But liposuction can be applied in many areas of the body, such as the neck, the arms, the thighs, the belly, the back, really anywhere, the calves even, the ankles in some cases. And liposuction is quite safe if done under 5 liters. The Aesthetic Society of the United States strongly urges that people try to stay under 5 liters, which is approximately 8 to 10 pounds of fat in any one sitting. That being said, there are people who will do more volume than that, but not us. We try to keep it safe. We'd rather bring you back for another site or yet more liposuction done once you've regained adequate blood count. In fact, most people who need more than 5 liters, in my view, probably shouldn't be getting liposuction, but should be looking at other procedures such as a tummy tuck or other body contouring, or perhaps even some of the newer and more sophisticated procedures for weight loss, such as lap banding or gastric bypass, which are generally done by a general surgeon. So the most common reason that people are turned away from my office are that they come in who are significantly overweight and are looking for a quick fix diet. Liposuction is not a good operation for them for many reasons. Even if you can get a little bit of improvement, you can't get more than 8 or 10 pounds down. And number 2, you clearly haven't demonstrated that you can get control of your diet. And after surgery, it's even more important to maintain your weight, because the areas that are remaining will still be able to get fat and will become more irregular and lumpy in appearance if you do gain weight. And further, if you gain weight, the areas that are not liposuction will get disproportionately large, i.e. you'll find your next problem area, which can make people look quite strange. It is not uncommon to people to start chasing their tail with liposuction and coming to their doctors every 6 months to get the next problem area done. Really, liposuction, again, should be used only for those people who have diet and exercise resistant fat deposits who are pretty close, although not necessarily at their ideal body weight. Now, what are the technologies in liposuction? First and foremost, I want to tell you that things that sound too good to be true usually are, and examples of which are mesotherapy, or the injectables and liposuction without removing any fat. There are clinics popping up all over the world now where people are claiming that by injecting different types of fluids and chemicals into the fat, dissolve the fat without removing it. There's no good long-term studies to support that, and most people are pretty unhappy with it, and I strongly discourage people from even thinking about that. That being said, there are many good techniques for liposuction. The gold standard now for liposuction includes tumescence. What is tumescence? Tumescence means that you're injecting your soft tissues or the area of fat with large amounts of salt water mixed with Novocaine, which is usually something to take away the pain, along with adrenaline, which is a constricting agent for the blood vessels. When you do that, the pressure that's exerted by the fluid on your blood vessels, along with the adrenaline, which shrinks the blood vessels, really reduces the amount of postoperative bruising that people get and truly limit the amount of blood loss that people experience with liposuction. So when you're using tumescence and you're staying under 5 liters, the expected blood loss from a liposuction procedure is minimal. And in fact, blood counts rarely change dramatically, which hastens recovery and really limits postoperative bruising. with the tumescence, there are several different techniques that people can use, doctors can use to remove the fat. There's the common standard reduction of fat with the cannulas, which are mechanical. It's just a hollow metal tube that's with force go in and out and remove fat cells. Most of us don't do that anymore. There are more sophisticated techniques for liposuction which are more elegant and less bruising. We commonly use either a combination of power-assisted liposuction or ultrasonic liposuction. Power-assisted liposuction means that the cannula which sucks the fat, or the tube which sucks the fat, is hooked up to a small motor generator which oscillates the cannula or moves the cannula in very small ranges of motion several thousand times a second. By doing that, it not only makes my job easier, but also reduces the amount of trauma that the patient has to both their muscle and their fat and speeds recovery. Ultrasonic liposuction has an ultrasonic generator at the tip of the cannula which bursts the fat cells. That's very commonly used in redo liposuctions or touch-up liposuctions. It's very commonly used in very fibrous areas like in men's breasts and backs and other areas which are really tough to get to. So we use all of those. There's a new technique with laser-assisted liposuction which has fairly limited application. We have not adopted in our practice yet, as I haven't seen the need or the significant increase in benefits, and stay tuned, that might be added, but not yet. The other techniques are really pretty terrific, and we do a lot of liposuction. I do probably 5 to 10 liposuction procedures a week. Let's talk about the recovery. Most people with tumescent liposuction generally are able to get back to their normal work activities unless they're strenuous at approximately 3 to 5 days. One of the biggest misconceptions is that it's a quick fix. In fact, if you look at most people at a week to 10 days after liposuction, they're more swollen than they were fat. It takes about 3 months to see the final outcome from a procedure. So most of my patients are going to be in a compression garment or something that's form-fitting for about 3 to 6 weeks after surgery to help the swelling go down. Some people will need to go on a mild diuretic to help the swelling go down, and we often will recommend massage therapy for people who have done it at home or professionally to help all the areas go down. Many people will get a little bit firm and lumpy, peaking at 6 weeks after the liposuction, and 1 in 3 to 1 in 4 people will need a minor touch-up procedure to get the areas perfectly symmetrical. Why is that? Well, it's a blind operation in best circumstances, and the areas that you're taking out fat, although we are quite compulsive about taking out symmetrical amounts from one side versus the other, don't always collapse symmetrically. And so some people will need to go back in and will, under local anesthesia, usually be able to remove the fat. Now that goes to the anesthesia question. How do you do this? Well, some people, depending upon the amount of liposuction and the number of areas being done, can be done under straight local anesthesia with the use of the tumescence. Sometimes we'll give you oral sedation. Many people opt for IV sedation or general anesthesia if the number of sites are quite large, i.e. more than 2, and there's a large volume, i.e. up to 3 to 5 liters. IV sedation is typically suggested. We do everything in-house. We have a AAAHC Medicare-approved 2-room surgery center, and most people are in and out of our facility within 2 to 3 days. The recovery is not too complex. You can be back doing exercise at roughly 2 weeks and really strengthening exercises with no restrictions after 3 or 4 weeks, with absolutely no restrictions on anything you can do at the end of this. It's very important that you maintain your weight after surgery, and we're going to weigh you before surgery. So people coming in looking for touch-ups at 3 months who've gained weight, we're going to put you on a diet. So it's really important that you know that you're going to have to do your part and your share in maintaining the body contour that we're going to give you. I hope you come in for a free consultation. If you're looking for my books, please don't hesitate to contact my office and we'll send you them for free. And please feel free to browse through our gallery on the website to look at pictures of post-operative patients along with the pre-op shots, and we're happy to provide you any number of patients who've had liposuction to discuss. One final thing is that every surgery has potential risks. The risks of liposuction, albeit smaller there, they include infection, which is rare, fat or pulmonary embolus syndrome, which can be lethal, very uncommon, most post-operative irregularities, and numbness, which is persistent for typically a short duration of time, such as a few months, and virtually always goes away. The scars, they're minimal. They're typically puncture wounds that are well concealed in places where you want them to go within reason. So we look forward to seeing you, and thank you for joining us on this video site today.